In part 2 of Newcastle Disease video presentation we have discussed about clinical sign and postmortem. In this part the control and prevention of Newcastle disease will be presented. Control and prevention. The general approaches to the control of Newcastle disease are hygiene and vaccination. This is always important, especially in the control of Newcastle disease in semi-intensive systems where birds are confined within a fenced yard or house. Hygiene includes measures such as cleaning, disinfection, limiting access to wild birds, and personal hygiene of the farm staff. Vaccination in combination with appropriate hygiene measures, this remains the most effective way of controlling Newcastle disease. Vaccination against Newcastle disease would result in immunity against infection and replication of the virus. Realistically, Newcastle disease vaccination usually protects the bird from the more serious consequences of disease, but virus replication and shedding may still occur. Vaccination. These different approaches to vaccination have been applied to Newcastle disease. There are 3 types of vaccines used for Newcastle disease: live lentogenic, live mesogenic and inactivated vaccines. Live lentogenic vaccines are usually derived from field viruses that have been shown to have low pathogenicity for poultry but produce an adequate immune response. Typical vaccine strains are HB1, Lasota and F strain and some viruses from the asymptomatic enteric pathotype, which are usually based on the V4 or Ulster 2C viruses. Vaccine application. Mass administration methods. In intensively developed commercial poultry industries, an important cost of vaccination is the administration. For this reason, mass application methods have been developed, primarily for live vaccines. Various forms of equipment are manufactured to generate coarse sprays, which allow mass application with minimum adverse reaction, although in some circumstances, mass application by fine sprays and aerosols are employed. Application of live vaccines via drinking water is still employed in some areas, although in the commercial sectors, this gives some problems in preparing and cleaning the drinking water system, with a tendency for a less than uniform uptake. Eye drop administration. Application of the vaccine by eye drop methods is probably the most effective for live lentogenic vaccines. Administration of the vaccine via drinking water. Vaccination by placing the live vaccine virus in the drinking water is easier than application to individual birds, but it provokes a lower level of immunity than eye drop administration, has less uniform uptake and requires more frequent application. The vaccine should be given twice, initially 2 to 3 weeks apart, with revaccination at least every 3 months. Oral administration. Oral vaccination of chickens with thermostable vaccines, i.e. NDV4HR and I2, has been successful in some developing countries. Administer by oral drench dissolved vaccine squirting into the beak of each bird using a clean plastic syringe. Administration via injection. Inactivated Newcastle disease vaccines are administered by intramuscular or subcutaneous injection only, in the breast or the leg. Inactivated vaccines should be allowed to reach ambient temperature, approximately 28 degrees Celsius, and the contents should be well shaken prior to use. If stored in a cool, dark location, an inactivated vaccine may retain its activity for 1 to 2 weeks outside a refrigerator. Inactivated vaccines are more effective in chickens which have previously received a living vaccine. Revaccination is usually done every 6 months. By this we are coming to end of today's program. Subscribe the HVS channel. Thank you for watching.